The immune system plays an integral role in combating infections both in the body and the brain. It is also responsible for inflammation, which can lead to long-term consequences in every organ system in the body, from the joints, where we see diseases such as rheumatoid arthritis, to the skin and diseases such as psoriasis and scleroderma, to the brain, where we see our own immune systems causing the most debilitating and feared diseases such as multiple sclerosis, ALS, or Lou Gehrig's disease, and many others. Some other well-known autoimmune disorders include lupus, asthma, and sarcoidosis. For every organ and organ system in the body, I can come up with at least one horrible disease that is rooted in inflammation. And when you really break it down, in every case, stress played a role in some form or fashion. This is where the science is lacking. Cortisol is known as the body stress hormone, as we had previously established. Yes, we all know what stress is. It's both physical and emotional, but what really drives it? Here's what. There are controllable factors, and there are factors that are out of your control, such as genetics, exposure, injury, and other mechanisms that we will not belabor. Instead, I'd like to focus on the things that we can control that will lower your stress. What will increase cortisol in the short term? Remember, cortisol is the stress hormone. These are modifiable factors such as amount and quality of sleep, diet, illness. Now, with regard to illness, I want to clarify that there are ways we can control this by not exposing ourselves to pathogens, and yes, viruses are pathogens, and by not injuring ourselves, or at least minimizing injury with preventive tools such as helmets and seatbelts. Toxins also increase cortisol both directly and indirectly. These can be environmental, dietary, or both. Even certain medications can cause fluctuations in your cortisol levels. Finally, there are obvious culprits, such as mental, emotional, and physical distress. These all cause increases in circulating cortisol levels. Illness that causes a surge in cortisol can be simple as a common cold or as serious as cancer. Physical distress can be pain, obesity, a ruptured appendix, a lack of oxygen from an asthma attack, or many other scenarios. Physiologic stressors can include chronic diseases such as diabetes, high blood pressure, COPD, hypothyroidism, the list goes on. Emotional or mental stress can take the form of anxiety, fear, insomnia, worry. The list also goes on and on. These are all normal responses to life stressors, but sometimes the response goes on and on for no good reason without being turned off. As I just pointed out, this can be in the form of physical stress, mental, or both. As different as these scenarios are, they all have the same effect on you. Elevated, unchecked cortisol levels can predispose you to become symptomatically infected with a pathogen, such as a virus. If your immune system isn't functioning properly, a pathogen such as a virus has an easier time hurting you. For anybody who has ever had a cold sore, why are they called cold sores? Is it because they're caused by the common cold? Or is it because you get them when you're cold? No, none of the above. Cold sores are caused by the herpes virus, while the common cold is caused by various viruses that are not in any way related to the herpes virus. Common examples of viruses that cause colds are flu, influenza, rhinoviruses, adenoviruses, enteroviruses, and coronaviruses. The herpes virus lives in the nerves and central nervous system after an infection. The reason people get recurrent sores is because that herpes virus that has been allowed to replicate and cause more disease at a time where it can take advantage of your immune system by letting its guard down. Now, how is this dormant or otherwise asleep virus allowed to come back and create a new problem on your lip? By stress. That's how. Your common cold took up the resources that would normally combat the herpes virus, but at the same time, cortisol levels increase, thereby lowering your immune defenses. There are many examples of diseases that make themselves known at times of stress. We won't discuss those in detail for now, because for now I want to talk about this awesome new field, psychoneuroimmunology.